Good afternoon. Now we have an afternoon presentation to follow the night presentation. So I'll remind you of 3 housekeeping things. First is pull out your cell phone and turn the ringer off if you would. That would be great. And second, if anyone has low vision and they want a larger evaluation form, just raise your hand and we'll get them out to you. We have a full page form. And last, and I don't know exactly how they work, but we have these hearing devices at the back. If anyone wants to try one to enhance their hearing, just raise your hand and we'll get you one. All right, the big show is going to begin. I have a few things to run by you about wonderful Robin, who takes care of everyone. But I asked her what I could share with you that you could try and guess on, and she sent me something, the 3 things for you to guess what the right answer is, but she didn't send me the answer. So it's kind of weird.
Probably only one person in this room knows the answer.
That's you?
No. Okay, 2 people.
Okay.
So you can't answer.
Robin has a cut between her eyes that she got years ago. Now, there are 3 ways she could have gotten this cut. Now, I'll say all 3 of them first, and then you can vote. Drunken bar fight on 6th Street, slipping on a sidewalk and hitting her head on a water fountain, or a fall during ice skating. Okay, we're going to take them in reverse. The fall from ice skating, who thinks that's it? Okay, pretty good. Slip on a sidewalk and hitting the head on the fountain, that's a little bit more. And now the drunken bar fight on 6th Street. Not many.
Darn.
You come across pretty good. Okay.
So yes, I was in a daycare. So I was really young. If the story isn't completely straight, let me know. I was in daycare, so real little, and I was running on the sidewalk at daycare, and it had those little pebbles, and I slipped on that, and it was a water fountain that didn't have the metal surrounding it. It was just the pipe, and I ran into that and sliced open my forehead. So my mom was called to come get me. It was covered. She told me, do not take off the rag for anything, and I had to have stitches. Then it got infected. I had to go back in, more stitches, and so yes, that's the scar on my forehead.
Now, y'all know Robin pretty well, so please give her a warm welcome.
Unfortunately, no drunken bar fight. I've never been in a drunken bar fight, or any bar fight. Okay, can everybody hear me okay? Those in the back, and y'all can see this okay? Okay, if at any point you can't hear me, just let me know. And again, I'm gonna walk back and forth. I'll try to be out of y'all's way as much as possible, but I'll move. It's also being recorded, so it will be put on the portal, and my slides will be on the portal also. If you miss something, I move too fast, you want clarification, I'll give you all my contact information. If you don't know how to get a hold of me, if you don't know where my office is, I'll give you all that information. So this presentation is my 3rd of 3 presentations. It's the last one of the year, and it's kind of what if. So it's all those questions that people plan for. So we're going to go through a lot of things to help you prepare for those what if scenarios. Of course, I can't hit everything. And everybody's situation is different, but I try to hit the highlights and the things that people ask me the most often throughout the year. And I've added some things, taken some things away, so I try to hit the highlights. So it's me, again. So we're going to talk about being in independent living, how to stay independent in independent living. We're going to talk about changes in health, personal caregiving assistance, therapy, pets, emergencies, a little bit on higher levels of care and resource guides, because I have a lot of information on the portal if you haven't already seen it. So the first question I do get asked, because we've had a lot of primary care doctors go concierge lately. And so, what do I do? Not me personally, this is you. What do I do if I have primary care doctor issues? So if you change medical doctors either on your own, or if one of your doctors is going to be concierge or stops practicing, or you don't like them, please let me know if you know your doctor is going to change, because we do have to update your paperwork. We need to know who we're going to be contacting in case there's an incident, or we need to get orders for therapy, because we notify your doctors. If you're needing to change doctors, we can give you recommendations on physician groups. I did hear recently that Capital Medical Group is not accepting anybody right now, which they're a large group, so that's pretty interesting. So I'm working on some other options for that. But please come to me, please come to the nurse practitioners in the clinic, and we can give options for close doctors, because I know there's some people who don't drive, or lots of people that don't drive anymore, so we do want to give you options. Some residents, female residents, only want female doctors. Some people don't care, so we can give you options for that. Okay, in my first presentation, we talked a lot about what happens if I get sick, what happens if I'm injured. So we can always see you in the clinic. You can call your doctor. If there is an emergency, what's the first thing you should do? Push your pendant, pull your pull cord. How many people have on their pendants right now? Okay, pretty good. Pretty good. Yes, so push your pendant, pull your pull cord. If EMS is needed, we'll call EMS. If it's the nurse's judgment that EMS should be called, we will call EMS. You can certainly refuse EMS at that point. But in our nursing judgment, if EMS needs to be called, we will call them. If you refuse them at that time, you're not charged for that, okay? But we may suggest that EMS be called, especially if there's a head injury or suspected other major injury. You can certainly call 911 on your own if you know that 911 is needed. So if you know for sure you're having a stroke, or if you hit your head, or you know you're having a heart attack, or something like that, you can call 911 on your own. But then also, pull your pull cord or push your pendant, because then security, nursing can come up and provide care before EMS gets here. If you're sick or have an illness or have a small injury, there's also some private duty assistance. You or your family would have to get that started. Westminster doesn't pay for that. I cannot get that initiated for you. I can't call an agency or a private duty person and start that service for you. I can give recommendations, but I can't get it going. There's home health. Either your doctor or the clinic can write orders for home health for a nurse from an agency to come and provide care to you. And we also have wellness checks. We've talked about that in my presentations before. It's a temporary service that Westminster does provide for short-term limited assistance in your apartment. If you have, if it's after hours or weekends, and you need to see a doctor because our clinic is closed on the weekends, please have your doctor's after hours weekends number either in your phone or on your refrigerator, because you can call them and get advice from that doctor service. If you have the flu or COVID or some other illness that is contagious, contagious. Please be mindful of the other people who live here so we don't spread it to others. So, stay in your apartment, and you can notify the clinic, you can notify me, we'll make a home visit, we can do wellness checks, we can do meal delivery, we can make sure you're taken care of in your apartment. And I just want to point out that the healthcare center is not a hospital. If you're having an emergency situation, we cannot take you over to the healthcare center and check you in for an emergency situation. We would send you out to the hospital, let them figure out what's going on before admitting. We also can't send you over there just for one night as kind of, oh, let's watch over you and then bring you back. There is kind of a minimum 7-night stay in the healthcare center. There's just so much paperwork, admission process that for an admission over there. And we like to make it a planned stay or a planned admission. So if you're sent to the hospital, if you're sent out by us or taken by your family while you're here and we know about it, I am notified by security and the nurse that responds. All incidents, an incident report is done and submitted into your medical record that I have access to. And then security fills out a security report and I get that also. So if a resident falls and they pull their pull cord, if a resident calls the front desk and security responds and a nurse responds, I get that information. If you're outside of Westminster and you go to the hospital or family takes you to the hospital, please notify me as soon as possible so that I know where you are and how to help you. I always follow up with the case manager in the hospital, so when you're sent out, either the nurse or security tells me where you go. If for some reason they don't know where you end up, I start calling all the hospitals to find out where you are. I talk to the case manager to find out what the plans are, kind of an estimate of how long you're going to be there and what the discharge is going to be back to your apartment. If you're needing a rehab stay, we kind of talk about what that plan is. When you return to your apartment, if that's the plan, you're followed up by the nurse practitioner for a transitional visit so the nurse practitioner can come to your apartment to evaluate you, wellness checks if needed, and then they can order therapy or home health. So if you return to the apartment, your apartment, in the evening or on weekends, say you go on a Saturday morning and you return Saturday night, we can do wellness checks because if I'm not here and I don't know you went out to the hospital and you came back because I don't check my emails every single minute on the weekends when I'm not here, you can always call reception and ask for them to send up a wellness aide and they can check on you throughout the weekend. So they call or radio for a wellness aide to come up. There's not a number that you call directly for the wellness aide, you just call up reception and they can do that. We have a schedule for the wellness aides, so we do already have people on the schedule. So say we have people that are already back from the hospital or came back from the healthcare center, they do have a set schedule. So if you're needing assistance, the wellness aide may already be with someone, so you may have to wait a little while until they can come see you, but we can get you on that schedule. And again, this is temporary help. It's not meant forever. And then when I come back to work, we can talk about how long you can be on services or how long you may need it. If you're needing extended services, so someone to stay with you overnight or for hours and hours, because wellness checks are only for 30 minutes, 3 times a day, up to 2 weeks. If you're needing more than that, then we talk about agency care or hiring someone to come and help you or your family helping you. If you're needing the healthcare center, you're in the hospital, and you're needing the healthcare center after surgery. So this is because it's an emergency admission to the hospital and you're needing rehab placement. I coordinate with the healthcare center. I know you're in the hospital. We're making a plan. The hospital's sending a referral to the healthcare center. We're getting you a bed. We're helping arrange transportation. I can help bring a couple of items over, not your whole apartment. We can bring a recliner, we can help bring some clothes over. I go to a meeting every Monday through Friday, so I'm learning about your progress. I'm learning if you're participating in therapy or not. I'm going to care plan meetings as I can. And then we talk about your progress. Are you participating? And because our goal is to get you back to your apartment. And I want you to try as hard as you can to get back to your apartment. And so if you're participating and you're getting better and you're making progress, then we make plans for you to come back to your apartment. If you're not participating and you're not getting better, then we talk about what level of care you should be in. But the goal is always to get you back to your apartment. So if you're going to have a planned surgery or a planned procedure, so say you're going to have a hip replacement in 2 months, please let me know in as much advance notice as possible because I put you on my radar, okay? Please notify me in as much advance notice. I need the date of the surgery or the procedure. This could be hip replacement, knee replacement, cataract surgery, major dental procedure, foot surgery, eye surgery. It can be as little or as much as you want me to know. The doctor, the hospital it's going to be at, and anticipated length of stay. So it could be an outpatient procedure, it could be a 5-day stay in the hospital. So this is kind of the information that we base our plan on of what we're going to do. So I follow up with you before and after the procedure, and I notify the healthcare center if we think a stay is needed in the healthcare. Some people have a hip replacement. They go to the hospital, have a hip replacement, and come back to their apartment. And they're great. Some people have had really severe mobility issues before the hip replacement, and they need more recovery in our rehab center. So they go have the hip replacement, then they go to our healthcare center for a couple weeks and then come back to their apartment. So everybody's situation is different. That's why we need to make a plan. So if you let me know you're going to have a procedure, we talk about options. If something happens outside of Westminster, you can carry my card in your wallet so people know who to contact. I did bring a stack of my cards if you want to pick one up on your way out. It has my email address and my phone number on it. Sometimes when residents are traveling, if something happens and you end up in the hospital, you can take that with you and family knows who to contact if they don't already have my contact information. But also, remember, this is independent living. Some people go to the hospital and say they live in assisted living. It is different discharge if you are at the hospital and you tell the case manager that you live in assisted living and they discharge you because they think you are getting more help than you actually get in independent living. They think there are people there 24/7 to help you, to give you medication, to help you to the bathroom, to help you get in and out of bed. And in independent living, you're supposed to be independent living, okay? So if you go to the hospital, remember, where do you live? Independent living. So if you have concerns about your apartment safety, so say you've had increased number of falls, or you're tripping more in your apartment, or you just don't feel quite safe, we can do a therapy evaluation for safety, or you can do a self-assessment. So you can go into your room or into your apartment and look for hazards. So, do you have rugs? Do you shuffle your feet? And do you have an edge of the rug where your toe catches, where your walker catches, where your cane catches? Do you need to take them down? Do you have cords from your lamps or your TVs that cross areas that you walk where you could trip? Okay? Do you have light bulbs that are out? to make it hard to see in areas of your apartment? Do you have papers and other items on the floor that can cause you to slip? Do you have lots of clutter? Maintenance can assist with light bulbs and things like that, or moving lamps, or finding a different way for TV cords and phone cords. Therapy can assist. They can do an evaluation. Or you can hire an organizer. Maybe you're a collector. I don't say hoarder, but maybe you're a collector of items and you have a lot of things in your apartment and life is too hectic and busy to organize everything. You can hire someone to help you. What if you just need a little bit of assistance? We do have a preferred provider agency that provides as little as 10 minutes of assistance per day. So you can hire them for just maybe it's hard to remember to take your medication in the morning. Sometimes that's hard. So you can hire them for 10 minutes to come by in the morning to remind you to take your medication. Maybe it's a little bit scary to take a shower because you're scared you're going to fall and slip in the shower and fall. You can hire someone to come and stand by while you take a shower just in case something happens. Maybe it's exhausting for you to get dressed in the morning. It takes 45 minutes for you to put on your shirt, put on your pants, put on your shoes. If you had someone to help you do that, then you conserve energy and the rest of your day is just fine. You can hire someone just to help you get dressed and then you go about your day. But you can hire someone up to 24/7 in your apartment. Again, paid for by you. It's not paid for by Westminster. But if you want to stay in your apartment as long as you want, this is an option for you. What if you're experiencing hearing loss? We have audiologists, 2 of them that come here, the first and third Wednesdays of each month. You would call the provider directly. Usually the flyers go up in the elevators. Their number is on there. You arrange the appointments. If you do need their numbers in between when the flyers go up, just let me know. There are also amplified phones, talking caller IDs, wear your hearing aids, change the batteries. Maybe you need hearing aids. There are ear cleanings. Some people make a lot of wax. Some people who wear hearing aids make a lot of wax because it's a foreign object in your ear and your body wants it out. So your body will produce more wax and you need more regular cleanings. If you're experiencing hearing loss, you're not always hearing the whole conversation. So that can cause social isolation, a decline in cognition, and missing conversation with other residents, with your family members. You just don't hear everything. The beautiful birds outside, the conversation with your friends and your spouses and the servers in the bistro. It can cause miscommunication and things to be misinterpreted. What if you're experiencing vision loss? You can purchase magnifiers or brighter lamps. Maybe your apartment needs to be assessed for brighter light bulbs or closer lamps. They have lamps where you can adjust it. Larger print items. I think Westminster's trying to get better on larger print items. You can also hire someone to help read you your mail. So it does get harder when you get bill after bill after bill and the print gets tinier and tinier and tinier. So you can hire someone to assist you with that. You can hire someone to help you with your medication. So I talked about having someone come by to help you with your medication. Some of those pills are so little, and if you can't see them, you may drop them. So you can hire someone to help dispense your pills, or you can get a medication dispensing machine. You can do apartment modification, so occupational therapy can help you in your apartment to modify it. And there's books on tape. So if you're an avid book reader, you miss reading books, to continue being a book reader modified, you can get books on tape. There's Alexa and other home devices that can be used. I hope we don't set off anybody's personal device. But your phone, you can say a certain name and you can ask your phone anything you want to ask it. And so it's capable of conversation with you if you want to ask it what the weather is outside, what the traffic is like, what the score of the baseball game was. You can ask it to set alarms, reminders. They do have watches that will talk and tell you what time it is, or all kinds of things. It can also control smart devices in your home, like turning on lights, turning on the TV. Okay, what if I'm having a physical decline? There's lots of things that we can start with. The first thing I would start with is being seen in the clinic or by your doctor, because it could be something that can be, an acute condition. So labs, maybe there's an infection going on, maybe there's something that can be reversed. We can do occupational therapy or physical therapy. They can recommend adaptive equipment, apartment modifications. They can do a motorized scooter if it's long distance. Those would be progressive. We wouldn't have a physical decline and go straight to an electric scooter, okay? We want to preserve your independence as long as possible. There's exercise classes at Westminster, possible conversation about assisted living or the healthcare center, and then privately pay for assistance. But again, it's a continuum. I want to do the least before we go to the most, okay? I want you to be as strong as possible. Durable medical equipment, so I can assist you with that. If you're needing something in your apartment, like a toilet riser, sometimes as we age, it gets harder and harder to sit further down. As our leg muscles get weaker, our arms get weaker, it's harder to sit further down and get up. So the 3-in-1 toilet chair it's called a riser also, and so it has handles. I can assist you in finding where to purchase those. If you need a shower chair, sometimes it's harder to stand up and take a shower, especially if you take really long showers, or the heat makes you dizzy and you have blood pressure issues. If you need a wheelchair or walker, hospital bed, or oxygen, I can assist you with that too. If therapy is needed, they can screen after a qualifying event. So say you had a fall in your apartment, they can come to your apartment and just screen you. You don't have to have an order for that. We can get orders from your doctor or from one of the nurse practitioners in the clinic, or I can request them. We verify your insurance. And we know you have insurance, but it's a thing that we have to do. If you go with Select Rehab, they will then call you to set up an evaluation and the sessions. And this can be done in your apartment. It can be done in the therapy gym. You can certainly use an outside group if you want to. You don't have to use Select Rehab. If you get an order from your doctor, say you go to your doctor's appointment, and they give you a prescription or an order for therapy, please bring that to me or my assistant Diane in the clinic, and then we will do the process for you. Select Rehab is the company that's here at Westminster. They do physical, occupational, and speech therapy. They also work with Halcyon Home Health Services. It's Part B. And again, in your apartment, the gym in the Windsor. They also work with residents outside. They have a little gym area outside that has stairs where you can practice stairs. They also have different flooring outside, so kind of like a little cobblestone area, and where you can practice that. Hallways, and then pool therapy if needed. Okay. What if I'm losing or gaining too much weight? Has anybody ever heard of the Westminster 15?
Yes.
Yeah, Yeah, you move in and there's so much good food that you gain 15 pounds. Yeah, or 30 or, yeah. So we can certainly do labs and an evaluation just to see if there's something else going on. Therapy can also evaluate. Sometimes when there's a weight loss, it could be a swallowing issue. With weight loss or weight gain, it could also be a cognitive issue. Something in the brain is either telling you you're not hungry or you haven't eaten, so it could be either way. We do have a dietary manager here that can meet with you if you have questions, if you've been diagnosed with diabetes or any other diet related. I can't think of anything off the top of my head. You have questions about protein, then she can meet with you and talk about options of specific eating habits. We have options. I put the Laurel there. I know it's offline right now, but it will be coming back. And then meal delivery if needed. If you're noticing any cognitive changes, again, clinic or your doctor. It's always good to start there if you're noticing any changes. Speech therapy. So I always think of speech therapy from the neck up. So cognitive testing, they talk to you about memory strategies and engagement and activities. There is a driving course at St. David's. I feel like they're kind of phasing that out a little bit. It's hard to get into. There's medication management through agencies with med reminders. Rachel Gill, our Life Enrichment Director, does cognitive testing if you want to have a test done. Then she can discuss the results with you and how to boost your recall. There are other places you can go for full testing where it's like half a day, full day with a neurologist. And then for the future, assessment for assisted living or memory support. If you're feeling lonely or unmotivated to join in, you know, we have our daily, weekly, monthly calendars. We have a lot here at Westminster. I kind of feel like if somebody's bored here, you're crazy. I think people can find something. And if there's something you're interested in that we don't have, speak up. We can create something. Maybe you can spearhead it. We have support groups, discussion groups. Rachel, reach out to me or Rachel. Talk therapy, you know, maybe hiring a companion that can help get you to these things. Talk with your friends. If you think it's depression or anxiety, again, let's do some labs. Let's get you evaluated. Rachel, she's a social worker. She can do some testing. We have a psychologist that comes here. Maybe some psychiatry recommendations, grief and loss group. I don't think it's currently meeting, but if there were enough interest in that. And then classes at Westminster. Endorphins make you happy. So right here. If you're experiencing grief and or loss, there's lots of types of grief and loss. So you stop driving, that's loss. Physical decline, that's loss. Losing your independence, losing your spouse, your friends, your pets, your physical abilities, your memory, moving levels of care, getting a new diagnosis, all of that can contribute to grief. We do have outside resources, but you have to let us know. We can't read your minds, okay? Just reach out. It's hard for us to know how to help you if you don't let us know. This is Rachel Gill, if you haven't seen her around here. She is responsible for meeting residents' social, mental health, and cognitive health needs through support groups. I think she actually has a group at Tooth right now. Supportive counseling and connecting individuals to outside programs and resources. So if you have driving difficulties, I've seen some of y'all drive. And I try to stay off, I'm just kidding. Y'all are all great drivers. So there is the driving course. Westminster has lots of amenities. You know, the presentations, the entertainment that we have here. I mean, Westminster is like its own little city. So if you're not driving and, we have our clinic here, we have so much here that if you stop driving, we have almost everything that you need. There's also Uber, Lyft, and taxis. We have transportation to doctor's appointments, banking, grocery trips. There are delivery services, so pharmacies, Shipt, Instacart, and H-E-B. You can get groceries delivered to you. Amazon and Chewy, so groceries. Amazon has anything you want and everything you don't want. Chewy has pet supplies if you have a pet. Favor, DoorDash, Grubhub if you want food. Say you're tired of eating in the bistro and you want something special, order you breakfast, lunch, or dinner. If you have a pet, please register them in my office. Do y'all know what the vial of life is? That little medicine bottle that's in your refrigerator that has your medical information. We make one for your pet. Just in case something happens to you, we know who to contact to come take care of that pet. So we know who the vet and the vaccinations are. We are working with a mobile grooming company, and we just started laundry services for them so that there's not pet hair in y'all's washers. So if there's an emergency or an alarm, like there was just 2 hours ago, we shelter in place. We give out instructions over the all-call system. We just had a presentation over this last month. Hope some of y'all came. If we evacuate, we go area to area to let you know. I have an evacuation list that I update every month that goes out to all leadership and security and reception so that we know residents' needs, if they're on oxygen, if they have assistive devices or pets. If the power is out, remain seated or take a seat. We want to prevent falls in the dark. If hospice is needed, we can do that in independent living. Okay? It's managed by the hospice agency. They can assist with medication, supplies, oxygen, hospital bed, bedside commode. That's what PSC is. A wheelchair, and LAL is a low air loss mattress, so that's kind of like an air mattress. But they do not provide 24/7 care. So if someone needs to be with you 24/7, you would have to hire someone to do that, or family would have to stay with you, especially if they're providing medication to you, like pain medication. You can stay in your apartment as long as you're safe to do so. If you weren't, then we can talk about a move to the healthcare center, and transferring with hospice is very easy. If you need a DNR, come see me. We can help you fill out the paperwork because we fill it out right. Some people get it filled out outside of Westminster and there's missing a signature, somebody didn't sign, the back's not on it, and EMS will not take it, and they will start CPR. So if you have any questions, you did it outside of Westminster, you haven't turned it into us, please let me know so we can talk about it. There's a bracelet and a necklace. It has to say Texas, out of hospital, do not resuscitate, for it to be valid and for EMS to accept it if you want to wear a piece of jewelry. What if another resident needs assistance? If they have fallen, don't assist them. I don't want 2 injured residents, please. Do you push your pendant? No, you push their pendant. Pull a pull cord that's close. If a resident is asking you to set up services, they either need to do it or their family must do it. Otherwise, are you going to use your credit card? Are you going to pay for it? No, they need to do it. If you have a dependent spouse, so if you're taking care of a spouse, we can work together to create an emergency plan for them if something happens to you. So if you're the primary caretaker for a spouse, we can work together to create an emergency plan. So if something happens to you, how are we going to take care of that other spouse? So we can meet and talk about that. If you think you need a higher level of care, let's talk. We'll set up a tour. We'll go take a look. There's an assessment that has to be done. We'll discuss a timeline for a move. If you think someone else needs a higher level of care, I mean, people tell me that all the time. Notify me. Many times we already know, but still, it's nice to know that other people are seeing it. Kind of confirms what we already know. A lot of families are in denial because they come see their parent maybe once a month, once a year, and it's a snapshot, and they think their mom or dad is fine. And we have to prove that they're not when we see them 364 days out of the year, okay? So it's nice to know that other people are seeing issues. But let's also be respectful and patient because someday it could be you. So let's be nice, okay? Most people are nice, but let's be nice. So situations that are not compatible with independent living unless you have 24/7 care in place, so agitation, combativeness, aggression, delirium, psychosis. If you're a danger to yourself or others, we're going to talk about a move. I cannot pick up any of you and drop you over there to memory or the healthcare center. That's not in my job description. I cannot grab you and move you, okay? Some people worry about that, but I cannot do that. Confusion with wandering outside the building. I get worried when it's 110 degrees outside or 19 degrees outside and people are wandering outside, okay? If that's happening, I'm talking to your family or your spouse. Incontinence, which is not manageable independently. So if you're not managing your incontinence, we're going to talk. Impaired mobility, so you're not able to transfer yourself in and out of a bed, on and off the toilet, in and out of a chair. We're going to have a conversation. Severe dementia, so you're unable to care for yourself, remember to eat, you have poor safety awareness, and you're unable to use the emergency call system. We're going to have a conversation. Or I'm going to have a conversation with your family about what we're going to do. Because my job is to keep you safe and independent living. Okay? So, what if you want information on the healthcare center, rehab, assisted living, and rehab doesn't mean physical, occupational, and speech therapy. This means the actual rehab floor, assisted living and memory. So you can contact me or Rachel, and we can set up an individual meeting. Because everybody's situation is different, we want to tailor our conversation to you. I do have a transitions handbook that I can send you if we're kind of talking about a transition. If I send it to everybody who's very independent, it's not going to really make a whole lot of sense right now. So I really give it to people when they're thinking or kind of needing a higher level of care. Assisted living memory support presentation is next week. 2 o'clock. Joe Sanchez, he's the director, please go. The Arbor, long-term care and rehab, Cassie Gotelli, September 10th, 2 p.m. Please go. Lots of good information. Resource guides. So on the resident portal, I have these 5 resource guides. So a health and wellness amenities. So this is based on the 8 dimensions of wellness. So physical, spiritual, there's 8. Go there and read about the 8, I'm so sorry. Resident health services, so everything my office does. A pain management guide, so what pain is, how to rate your pain, what you should ask your doctor. Non-pharmacological pain management, so if you don't want to take medications, how you can manage your pain. A pain diary, so you can go there and learn about pain management. Internal resource list, so things that are here at Westminster for resources, so the audiologist, how to get a hold of them, rehab options. An external resource list, so outside community resources like care management, pet walkers. If you need anything else, let me know and I can always add it. So if you go to the resident portal, on the left-hand side, it says resource guides. Click on that, and then you'll get all these little all these little, right here. And then you can click on those and see the resource guides. If you need more information on the Nurse Practitioner Wellness Clinic, I know they had a presentation last night, yesterday. But that was colds, allergies, COVID.
Yes.
Yeah. Sometime. So they have a clinic presentation on what the clinic does, October 15th at 2 p.m. Note the date changed. We had to change the date. So if you want to change that on the wellness committee, we had to change it from like the 22nd or something like that. What if I have more questions? Come see me. Come see Rachel. Again, when you leave, my card is back there if you want to pick one up to put in your wallet so you know how to get a hold of me. Does everybody know where my office is?
Yes.
Yeah? By the bistro. Say hi. Sure. Do we have questions?
Is there a difference between like skilled nursing and long-term care? A difference between needing to stay where there's nursing care for 4 or 5 days after some major health event or surgery in the hospital, and you're back and you need a few more days in a hospital-like setting, and is that in the arbor, or is the arbor separate for people who may be declining and need to be there for 6 or 8 weeks or 2 or 3 months?
Sure. So the arbor encompasses both of that. So the arbor is in the Windsor. It's the first floor and second floor. So the first floor is rehab. So that's that hip replacement, knee replacement, kind of in and out rehab. The second floor is long-term care. So if you're declining, you need kind of 24/7 care, that's second floor. Sometimes second floor is full, and so you would have to go to the first floor until a bed opens up and then you move up. But yes, usually people that are there for, you know, that quick turnaround, if it turns into 6 weeks, but you're just there to rehab, get better, and come back to your apartment, it's usually the first floor. But that's all the arbor. It goes by like 15 different names. Yeah. But it's rehab, long-term care, all the arbor.
Hi, we have some acronyms on your handout that are not
Sure.
completely clear
Yeah.
as to what exactly they are.
Okay.
So is HCC the Healthcare Center?
Healthcare Center, yes.
Okay.
Which is also the arbor.
And that's also called the Arbor?
Yes.
Okay. Now, the Arbor is divided up into separate sections, too.
Rehab, long-term care.
Okay. And we have the NP clinic here in Westminster.
Nurse practitioner.
Okay, that's Kathy Cody's.
Kathy Cody, Ann Lipscomb, and Mindy Coakley.
Okay. And they do blood tests, blood pressure checks.
Acute visits, chronic care visits, yes.
Yeah. And then I think I've got it all covered now.
Okay.
For the ones that I had questions about.
Yeah, I couldn't get everything on that handout because it would have been 6 pages long, so I just hit some highlights. Ms. Mitchell, did you have a question?
You mentioned that Capital Medical Clinic, or the Capital Medical Group is, Dr. Pellegrini is not accepting new patients.
So Dr. Pellegrini has a wait list,
Yes.
and I can put
Okay.
residents on that wait list, but Capital Medical Clinic, I heard from a resident that they're not accepting new patients at this time.
Okay.
But that, I just heard that from one resident. I haven't confirmed that
Okay.
yet.
Okay, I'm on the waiting list for Dr. Pellegrini.
Okay.
So, should I be calling their office and say,
Do you have another primary care physician right now?
no?
No? He's not accepting anybody in IL right now. Dr. Kroll's not accepting any, because he does mainly assisted living, memory support, and healthcare center.
Are you talking about
Dr. Kroll, yeah.
But if I'm already his patient, I
You stay his patient, yeah, yeah. Some residents who have been to the healthcare center and he picked them up in the healthcare center have stayed his patient. Yeah.
I have another question. I've heard that if you fall, you have to call EMS or someone has to call EMS. Only certain people can help you get up. Could you clarify that?
Sure. If you fall, a nurse has to be called. Security cannot get you up by themselves. They have to radio for a nurse. If there is looks like a major injury or a head injury, then they will call EMS. Yeah. But security is not supposed to pick you up by yourself. Now, if a resident is trying to get themselves back up and says, I don't want a nurse, I'm going to get myself back up, security can kind of like this, but they cannot assist the person in standing back up. They can just kind of stand there and kind of guide back up. But yeah, that's our policy is a nurse needs to respond to the falls to assess for any injury.
I have a question, which is not quite relative to this, but I'm just very curious about COVID. Right now, supposedly, our healthcare center is shut down from volunteers and other people
Yes.
because of the COVID.
Yes.
Okay, why is it that people that are in that particular area can come out and go to the dining
They should not.
venues? They should not be, as far as I'm concerned.
Correct. They should not.
But that was the question that I had, because I thought I had seen some in the dining
Okay.
areas.
I'll-
And I don't know who needs to know that,
I'll let Cassie know.
but anyway,
Okay,
okay.
I'll let her
Thank you,
know.
that's my question. I felt sure they weren't supposed to be, but people were rolling in today, so. But maybe
I will address that.
Maybe I'm wrong.
Nope, I will address that. We don't want it over here, just like we don't want to take it over there because people are immunocompromised. We don't want to spread those germs. I will address that, yes. Yeah, yeah. Anybody else? Oh, one more. We'll take one more.
I just want to make a comment about if somebody falls in your apartment and you're bleeding, you should have enough first aid supplies in your own apartment so your spouse can stop the bleeding before the emergency people show up. Otherwise, you may bleed out. Okay? Just a word of warning.
Thank you so much for coming. I appreciate it. Tell your friends it'll be on the portal as soon as I can upload it. Thank you.